The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the webinar. This is your next step to patient-centered medical homes and evaluating or assessing how or what your practice might need to assist it to be more patient-centered ready. So congratulations for doing all the hard work and getting your assessments completed. Now it's time to analyse those. So let's have a look first of all, some of the things that you're going to need to work through this webinar. The first three things that you will need will be three documents. The first document is, of course, your results that you can see now on the screen. And you would have got these via an email once you've completed your assessment. The second document you will need will be the blocks mapping. Now, this is a document that's been sent to you in an email from your practice support person. And it has each of the areas of the assessment outlined from 1 to 8 and which of the blocks those areas align to. And we'll go into that in more detail in a second. The third document you will need will be the alignment blocks table. This helps you to tabulate and it shows a pattern in some of the areas that you might need a little bit of training and development in to enhance your patient-centered readiness. So let's continue with those. So there's three documents. Is 1, your assessment results, 2, your document blocks mapping, and 3, your table that records the blocks that align. Okay, so we go on and we start this. I've got a practice that I have put up as an example, and it's practice XYZ. And the first thing I'm going to do is I'm going to identify my 3 lowest online assessment results. So, and they will be in percentages. So let's have a look at what I've got here on this example. Excuse me while I just go back. We can see here that area 1, so engaged leadership, is one of those. And probably area 4, which is your continuous team-based relationships, healing and relationships, and then area 5, which is organised evidence-based. So they're the 3 areas that I have identified in my results that might need a little bit of an improvement. So what I'm going to do here is I'm going to move through this. So going into my block mapping that I've identified those 3 key areas, and I'm going to just highlight them. So area 1, which is engaged leadership, and we can see here now it begins to align with particular blocks. Area 4, which aligns with blocks 1, 3, 4 and 5, and area 5, which aligns with 1 through till 7. So write them in your table there. So I've just repeated this for you on a slide. So part 1, blocks 1, 2, 4 and 5. Part 4, 1, 3, 4 and 5. And part 5, 1, 2 through to 7. Here's an example of the table that I have. So the first thing you'll see in priority 1 areas, we've identified from area 1, blocks 1, 2, 4 and 5. From the block in your assessments that have been identified for area 4 are 1, 3, 4 and 5. And in your third lowest score, you've got, I think, section 5, area 5, which is 1 through till 7. You'll see now a pattern. For example, in block 1, there is 3 ticks against that. So I've just highlighted that a little bit more. And in block 4, again, there's 3 times that's been identified. And in block 5, 1, 2, 3 times. So those 3 blocks, possibly the areas within my practice that may need some more training development and some support. So let's look at what this means as far as training and development or a support. And again, I've just repeated that there for you. This is your training ready reckoner, and your practice support person will definitely go through this with you in more detail. But if we quickly have a look, what we can see is that the training and development that's been identified to assist to improve these areas are Block 1, we've looked at 3 key training options, which is your practice, leadership and advantage, and that's generally for your senior clinicians, practice managers, and maybe some lead nurses. The second one is lean healthcare training, which is about being efficient, effective, have a good patient flow for in the healthcare system. And then, of course, we've got the Australian Practice Nurse Association as well, and the data optimization. But in Block 1, we've only basically identified these 2 key areas: practice leadership advantage and lean healthcare training for all of the practice. The next one, the Block 4 that's been identified, repeats in that practice leadership advantage training and also in the lean, but has an additional area that could be improved with some training from the Australian Practice Nurses Association. And that's generally targeted towards your practice nurses to do with chronic care management and team coordination. Block 5 identifies the training that relates to your practice leadership advantage again, your lean training within your organisation, and your practice nurse training to do with your chronic disease and team care coordination. They all also look at data optimization. So you've got 3 key training, possibly 4 key training options there. Let's have a look at those. So you've got clinical and business leadership for the GPs, practice managers, and also lead practice nurses, depending on how your practice is set out. Your lean training for all practice staff from the white belt level to the black belt, and there's more explanations regarding that on the training synopsis. And your coordinated care for chronic disease for nurses, as well as data optimization with your practice support staff. And also there'll be some little webinars that will be available on how to improve the data that's being recorded within your practice for both best practice and medical director. So we can see there's some 4 areas of training that we could choose from. How do we go about choosing that now? We've set up some synopses for each of those trainings that are available, and those synopses detail a little bit more into, what hours of commitment you will need for that training, who's best to attend that training, when the training, if any workshops within the training are required, are going to be available, and who will be conducting that training. There's no cost, of course, to your practices, as Northern Queensland Primary Healthcare Network will be funding those. So to get more information about your training, I suggest that you go to the web page, which is NQPCMH. Click on the resource page and then on the training link, and what will come down is that there'll be a little link there for you. We were hoping to get a direct link for you at the time of making this webinar, but unfortunately that hasn't occurred. But again, speak to your practice support staff. They can really help you with this. So there you can see more detail about your training. Now, if you have any further questions regarding this webinar or any of the information or any of the processes, please do not hesitate to give me a call. My number is there on the screen at 0439 794 660. Thank you very much, and I hope you enjoyed the webinar.